suffer from frequent headaches. People think that stress and loud noise are usually the main causes of a headache, but that's usually not the case. The origin of headaches, more often than not, tends to stem from the neck and shoulder area. Tightness can cause misalignment in the vertebrae of your neck, thereby causing pain. With a typical headache, a person feels the pain originating at the base of the skull and then moving up to the temples, eyeball, and forehead. Gentle neck and shoulder massage treatments can release tension and help relieve headache pain. Chiropractic adjustments can realign the vertebrae in your neck to treat the root cause of the headache, usually caused by poor posture. This is by far the most holistic approach to treating your pain. We have years of experience helping other patients treat their headache pain. Let us help you finally put an end to yours. Contact us today for a no-obligation consultation.
All right, so let's see. Let me just run this down. So tell me, what's going on? What brought you in?
A lot of body aches and pain. My right arm here. So I work.
You mean shoulder?
I mean shoulder, yeah. So I work in a supermarket and I work on the grocery department. So I lift a lot of things. So every time I lift something up, this shoulder gets really sore.
Okay.
And then the whole arm. When I sleep at night, it gets numb.
Okay.
When I carry my child on my right hand, I couldn't carry him for like no more than 5 minutes.
Okay.
So when I wake up every morning, or even when I sit and I get up, my legs gets numb, and I always have this heel pain, like this really sharp pain on the back of my heel.
Okay.
I would say my lower back is in a lot of pain. I wake up every morning with pain, like, I don't know, like I just got ran over by a bus or something like that. Yeah. So that pain, it's constant in my lower back. Just my whole entire body in general.
Okay. So let's start with the low back pain, and then we'll move up.
Okay.
So you said low back pain, and then have what, shooting pain down your leg?
Yes.
The right leg, does it go above the knee or below the knee?
Below the knee.
And how far down was it? To your heel or to your toes?
To my heels.
Okay.
To my heels.
Okay. Just the back of the heel?
The back of the heel.
Okay. And how long has this been going on? Time-wise?
I would say ever since I had my second child, so he is 3 years old now.
Low back pain. Okay, about 3 years. And is it getting progressively worse?
I've been to acupunctures and I've seen other doctors for my...
Chiropractors too, or no?
A chiropractor, no. Mainly acupuncture, herbalist, and it helped with, because I used to have more pain on my, like, the whole entire feet. She did a couple needles and it got better, but this part, the pain is still there.
Okay.
Yeah.
Okay. Now, moving up, so that's the lower back. Now, in terms of the shoulder, and has it been injured? Did you fall on it, or it just started? The pain just started on its own.
I might have injured, but I have no idea when did I injure myself.
And how long has this been going on?
It's been a while already. I would say probably 4 years.
4 years?
Yeah, ever since I started working at the place I am working at now.
4 years. And what's the level of pain in your low back, 1 to 10?
In the morning?
Yeah.
That's like an 8. As the day goes on, it gets a little bit better.
Okay, stretching.
Uh-huh.
Okay. And then shoulder?
Shoulder, it's mainly when I'm lifting or holding.
What's the level of pain?
The level of pain, I would say it's about 6.
6 out of 10. Okay. Any neck pain associated with your shoulder? Any headaches?
No.
No?
No
okay.
neck, no shoulder.
Okay. Okay. All right, so let's take a look and see what's going on. Lean back, please. Anything around here? Yes?
Yes.
Forward, up, yes?
The pain is like
Right there?
where you were holding it. Yeah, right there.
Okay. Does it hurt when I move it like this?
A little bit.
Okay.
Uh-huh.
When you do it yourself, does it hurt?
No.
No? Okay. Any pain around here?
No.
Here?
Uh-huh.
Then forward, please. Back. Forward again. Okay. Okay. Stand up, please. Face the window. Close your eyes and march in one place. Stop. Please have a seat. Okay. Hold this, please.
Mm-hmm.
So starting with your, we'll go from the top to the bottom. So the neck, the left side of your neck doesn't have any range of motion, so it's restricted. And most likely, I don't know what something happened in the past, but since you've never been to a chiropractor before, probably just wear and tear, from giving to childbirth and then having a physical job and just stress and things you go out of the place. So most likely the referral pain comes from the neck and comes to your shoulder, but then shoulder, your the deltoid tendon that's attached to the shoulder right here. When you touch it, press hard right here.
Yeah.
It hurts really bad. So we need to fix this as well.
Okay.
Most likely it's an overuse injury because you're lifting stuff up at the grocery and stuff like that, and then carrying your baby
All the time.
all the time.
Yeah.
And probably right hand. Are you right-handed?
Yes.
And the right hand more than the left one, so
yeah,
it's an
definitely.
overuse. It's very typical,
Okay.
carrying, and then the right shoulder is hurting too much.
Okay.
Your pelvis, basically, the right side of your pelvis is about 2 inches lower than the left side,
Okay.
and that makes your right leg longer, left leg shorter.
Okay.
So what happens, the nerves that come out from here, from the sacrum and from the lumbar spine, they go down your leg. When this happens, they put too much stress on the nerve, and then in the morning when the muscles are tight and stiff, they're pulling nerves more than versus at the end of the day when they're a little bit more stretched and flexible. And as a result, when they pull these nerves, they have these symptoms going down your legs.
Okay.
Okay, so basically it's a structural misalignment. And when this happens, your lumbar is compensating on the right side. Okay, there's no range of motion on the right side of your lumbar, and then the rest of the spine is compensating. And it's like a pizza tower, when the base is out, the whole thing is going to lean. But then the pizza tower doesn't compensate, but this spine will compensate and will create this basically these points where they compensate, like in the thoracic spine. Your right shoulder is about 1 inch higher than the left one, and then your right ear is about 3/4 of an inch higher than the left one. So what we need to do is to make these lines parallel. Okay. Before I adjust you, I'm going to set you up for heat and stim.
Okay.
It's going to help me to relax your muscles. And I'm going to adjust you, and hopefully by that time Gail, my massage therapist, comes in. If not, then I'll put you in a chair and then we'll massage your entire spine.
Now that I saw this, it actually reminds me that I have this sharp pain like right here on the butt area, but it's like it's a really sharp pain that it's like deep inside.
Left side of your...
My left, yeah.
The left side. Let's not chase the pain. Let's just focus on where the problem is, structural problem.
Okay.
And then see how you feel after I correct everything.
Okay.
99.9% of the time, when you fix structural, if it's structural related, these symptoms will go away.
Oh, okay.
If there is a soft, that's why we do soft tissue, deep tissue massage to fix up the rest of the spine of the problem. Because structural is one thing, but then the soft tissue is another thing. So after I adjust, we're gonna give you a massage, okay? So to fix the rest of the problem.
I hope.
Makes
this
sense?
is gonna be good, work good.
Yeah.
Yeah.
Do you have any other questions?
No,
No?
you explained it really well.
Okay.
Yeah, thank you.
All right, so let's set you up, and then we'll just go from there. I'll adjust you, okay?
Okay.
All right, so keep your hands down. Take a deep breath in. Out. Okay. Take a deep breath in. Good. Go on your side, face me, let me sleep on your side. Okay, keep this leg like this. Give me your left hand. Okay, keep your head straight, just like the way it was. Okay. So you're gonna have a feeling that they're gonna be falling off the table, so just relax, okay? You're not gonna fall.
Okay.
Okay. Relax your shoulder.
Wow.
You felt that move, no?
Yeah. Oh.
Have a seat. Okay, lean back. Okay. Just relax. Relax. Okay. And now I'm gonna adjust your lumbar spine, okay? So your head line on the side, this way. Give me a second, let me turn it on this guy. You relax, okay? Relax. Relax your neck. I mean your shoulder. Relax. Okay. Sit up, please. How does it feel?
Amazing.
Okay. Stand on your feet. Do you feel a little bit more balanced?
I don't know.
You don't know yet.
I don't know yet.
Okay. All right. Sit down. For a second. Okay. Let's do your shoulder stretch. Does it hurt?
A little bit.
A
Not
little
as much
bit?
as
Okay.
before.
Okay, well, we're getting somewhere. All right, so let's go. I'll set you up for the massage, and then we'll go from there.
There's another doctor.
Okay, so this is our second visit today. So how do you feel after your first session?
Good. I didn't feel any pain. I didn't feel any pain on my arm.
Mm-hmm.
I woke up this morning, my heel wasn't in pain.
Well, because it started equally distributing the weight. What was the
Yeah.
percentage of improvement after that first session?
Improvement. Improved a lot.
Like 10,
Percentage
15,
wise?
20, 40, 50, 60,
I would probably say at least half.
50%?
Yeah,
That's
at
not
least
bad
half.
after
Yeah,
the first visit.
at least half. Yeah.
That's
It
good.
feels different.
Yeah.
Uh-huh.
So after we finish with you, we're going to look at your boy who
Mhm.
has asthma attack.
Yes.
And currently he's what? He's doing inhaler and stuff?
Inhaler. He's been into the ER twice this year.
Okay, that's not good. So
Yeah.
let's see if we can help him out. Then
Okay.
most likely you might want to expedite the healing process. So the respond, maybe you want to do a couple of acupuncture sessions, but I don't know how he's going to respond working with needles. Maybe he's not going to like it. No kids like needles.
Yeah, he's very afraid of pain.
Yeah. All right. So let's just give you a treatment and then go from there. Okay?